So hi friends, my name is Meher Patel. I'm the director at UPHI, the Wellness and Surgical Center on the Golf Course Road, and I have with me Dr. Himanshu Gupta, who's a minimal invasive spine specialist worked with Fortis and Vedanta Hospital and now with us at the UPHI and Wellness Surgical Center. So today we are going to talk about very important thing about what is a slip disc. And we will also take you through what are the kinds of slip discs which bothers a person. So, Dr. Himanshu Gupta, please let us know what is a slip disc. I think you have a model here as well.
Good morning to all. Today I will just talk to you about what is actually a slip disc. So in this part, this is your lower back. So this is your lumbosacral spine. So these are the vertebrae, which are the bones. In between them, these are the shock absorbers that the nature of the God has given us, which gives us a cushion in the spine.
Right.
And these small yellow structures are the nerves, which are coming out from this yellow thing in center, which is called the spinal cord. So these bones, they are actually given a good support, cushion by these discs. And day in and day out, these discs are under a lot of pressure and a lot of wearing.
Mobility.
Yes, because you have these bendings, going
Forward.
back, lifting stuff, sitting long hours. Disc by itself, when you talk about structurally, in a kid, it is full of water. That's why the kid is so flexible. As we gain in age, the water content starts decreasing inside the disc, which is a sign of a dehydration of the disc. Now, if most of the people, when they get their MRI done and it says there's a desiccation or a dehydration of the disc, which is a normal aging process, then doctor, I have a disc problem. So again, that happens when you are overdiagnosed with MRI and these things. So a disc, in my case, his case at this age would be definitely dehydrated compared to what we were when we were born. And from my side, and if I need to use a app to age, similarly, if I use an app to age on my spine, the disc water content would have completely dehydrated by that time. So that is what is something which is a normal process. We should not be too much worried about it.
All right.
Now I'll talk about different types of disc or the disc bulges that we have.
Disc bulges. So different types of disc. Different types of situations with the disc. All right. So let's go on our drawing board and let's have Dr. Himanshu Gupta show us the different types of disc.
So this is a cross section of a disc that we were talking about in the spine model. A normal disc on the outside has the annulus, and on the inside is the nucleus pulposus, the NP, which is the fluidy content, man. So I mean that's where the fluid or the jelly part of the disc is. And the annulus is like a tire tube which has a good content of fibers of collagen, which actually keeps it in place against all these minor traumas. Now, if we have had an incident or I've had a sustained pressure on the spine because of the wrong way of doing things, that leads to a little bit of a bulge in the nucleus, which tends to sort of bulge along with the annulus outside. So when these sort of discs are bulging, wherein the annulus or the outer covering is intact, we don't call it a slip disc, it is just a disc bulge. But that doesn't mean at all that they are asymptomatic. No. If the same bulge is happening at the pressure point of the nerve, so I mean if suppose this bulge is here where the nerve is coming out into the leg, even a disc bulge will cause a pain in the leg or a sciatica pain.
So what you're saying is that if this bulging is obstructing the nerve, then the nerve is getting compressed, and that is the reason causing the pain in the leg or something. Okay, fantastic. Now, let me hold that for you.
Yes, and if there is a sustained pressure now, or if the force, the initial force was too high and the annulus has broken down, that's where the nucleus has come out and leaked out. That is what is called the disc prolapse or extrusion. So that is actually, scientifically speaking, that's what is called as a slip disc. Not these and these. So that is what is called as a slip disc or a disc prolapse or disc extrusion, wherein the part of the fragment has actually leaked out from the nucleus because the outer covering of the disc, which is the annulus, has broken down.
Has broken down. So this annulus, if it is broken
down and the jelly has come out,
the nucleus has come out.
So that's when this is the annulus which is broken. This is the nucleus which has leaked out.
Okay. So this is the situation of a slip disc when the annulus is coming out of. I mean, the nucleus is coming out of the annulus. Okay.
And this is the most advanced of that stage, wherein you have this part of the disc which had come out, which has broken out from the mother fragment. These are called sequestered discs, which effectively means that that fragment is now not around the disc material. It has leaked into the spinal canal, broken away from the mother disc, which is called a sequestered discs.
Okay. Yes. So what are the symptoms in this situation?
Symptoms would probably
be the same.
It will be a lot of overlap in all of this.
Okay.
But in a sequestered and a disc extrusion on a slip disc, you'll have more of nerve pain, more of nerve weakness, bladder bowel involvement, and these symptoms. Compared to a simple just back pain.
Simple back pain.
A simple back pain could be because of
these three.
But a leg pain or sciatica pain would be because of these three.
All right, fantastic. So that gives us a very good idea about what slip disc is all about. And I'm sure that there are various treatments for each of these situations. And most of these treatments are basically minimal invasive. Now, when we talk about minimal invasive, means there is no cut. It is mainly without any cut. So we would like to talk to you and we will take you through the basic various treatments which could be involved in any of these situations in our future videos. So please, if you have any questions, write down those questions down below, and in our next videos we will take you through the answers to those questions. All right, it is a pleasure talking to you. Thanks a lot, Dr. Himanshu Gupta. Thank you.